Hello, our viewers out there. Welcome to today's show. And today we are going to continue with our previous topic on breast cancer. And with me in the studio is a very health enthusiast by name.
Victoria Ready.
Okay, and in the studio also is a crew member by name.
I started.
You're welcome to the studio.
Thank you very much.
So, last week we were on signs of breast cancer. How do you know you have breast cancer? Like one of the signs we saw was a nipple discharge and a change in the shape of the nipple and the breast pain. Those are the ways you can know you have breast cancer. So today our health enthusiast is going to tell us more about breast cancer. Please stay tuned. So, Miss in the house, I want to ask, does having one or more of these signs you told us previously, does having one or more of these signs mean we have breast cancer?
Actually, that's a very good question. You see, having one or more of these signs is not a clear indication that what someone is actually facing is breast cancer. Let's take example nipple discharge. It can also be caused by an infection.
Okay.
Yeah.
Wow, that's interesting.
Wow. So, is breast cancer a key point of is breast pain a key point to breast cancer?
Okay, that's a very good question too, Mrs. Epithets. See, when most women, when they have breast pain, they think it's one of the, or it's a main cause of breast cancer. Breast pain, also known as mastalgia, is rarely the first noticeable symptom of breast cancer. It can also be caused by lots of factors such as fluctuation of hormones during menstruation. It can also be caused by some birth control pills that women do. It can also be as a result of some infertility treatments, and it can also be caused by some brazier not being able to fit the breast properly. So those are other factors that can contribute to breast pain.
Wow. Imagine the things we don't know. So please, this breast cancer there is breast cancer there, breast cancer here. Do men also have this breast cancer? Can a man contract or can a man have breast cancer?
You see, majority of people think men don't have breast cancer. Men also have breast cancer.
Really?
Yeah, they do have breast cancer, but in their case, it's very rare. It occurs at any age, especially at old age. Now, this rare cases is in men is as a result of the fact that their breast cells are much less developed compared to women. And for men, the common symptom of breast cancer is a lump in the breast.
Wow, that's beautiful and nice to hear. So, hearing all this, how can breast cancer be prevented?
Okay, one of the ways it can be prevented is by consumption of leafy vegetables such as spinach, because it contains these carotenoids such as beta carotenes, and consumption of allium vegetable. What I mean by is consumption of onions,
Okay.
ginger, turmeric, the consumption of apples, fruits like apples.
Is garlic among consumption of garlic? Is it among?
Yes.
Okay.
Consumption of fruits like apples, pears, even consumption of fish like sardine, mackerel. You know, they contain omega-3 fats and selenium, which are anti-carcinogenic agents.
Okay.
So those are, even consumption of beans are also ways we can prevent it, and
Breast
reduction
cancer.
of consumption of red meats,
Okay.
reduce your alcoholic intake. Yeah.
All right. You've heard everything in the studio, and now I want to ask this last question. Please, our very able health enthusiasts, what's your advice? What's your candid advice to our honorable viewer out there?
Okay, to a wonderful viewer, my advice is that you should endeavor to have a monthly breast examination. Don't because
the one.
yeah, because the breast cancer, there is a great possibility of a reoccurrence of breast cancer after treatment. So you need to take a monthly breast examination, very important. And when you go there is going to be a physical breast examination, use of instrument like mammogram, sometimes magnetic resonance imaging, and also we talk about the foods that you need to consume, okay, and those ones you don't, so you take them
Stick
very
to it.
yeah,
Okay.
and
Okay.
can
Wow.
and if you have the cancer, endeavor to follow up with the treatments. We can conquer breast cancer.
True. Together we can conquer breast cancer.
cancer.
Thank you very much, viewer
That's
out there.
wonderful.
It was good having you in the studio.
Yes.
Please, thanks for watching.